shown all the time. And if I asked even the doctors in this room to describe their male sexual organs, they probably would only stop at the shaft. We always put a lot of emphasis on educating people about the female reproductive organ, that women have ovaries, that they have fallopian tubes, that they have a uterus, that they have a vaginal canal. But did you know that men also have a reproductive health system? It tells us a lot that perhaps we are putting a lot of emphasis on educating the girl child, putting a lot of emphasis on educating the woman, and neglecting the boy child. And this has to change today. I was very happy when Dr. Wilford Kirungi said that he has got a new interest this morning, that he's now going to work with young people and educate them. So give Dr. Kirungi a big clap. So I'm going to quickly talk about prevention. As you can see, that image over there is a condom covering 2 fingers. But please do not put the condom on your fingers. It has to be put in the right place. I see Jaja Condom here. Please raise your hand. She's been educating people on how to use condoms correctly. Young people need to be told the truth. You cannot do a condom demonstration on fingers because they'll put it on the fingers and then they'll get an STI. Dear ladies and gentlemen, there are so many sexually transmitted infections. And the next slide shows you images of those STIs. From genital warts, to gonorrhea, to syphilis, to trichomonas vaginalis, there are so many. And there are over 1 million sexually transmitted infections that are acquired every single day. I hope you are not one of the statistics that acquired an STI last night or this morning. Are you? Yes or no? Every year, about 357 million new infections of chlamydia, of syphilis, of gonorrhea, of trichomonas are seen in the hospitals. And these are key facts. That some STIs don't have any symptoms. Without using protection, without using a condom, or kissing the person who has herpes simplex, you're definitely going to acquire that STI. But now, next slide please. I'll go to the point. Next please. Next slide please. That HIV and AIDS, which we are talking about, can be prevented. Do you believe that HIV and AIDS can be prevented? Do we know that there's a plethora of behavioral and even medical ways in which HIV can be prevented? All right. We know that HIV remains a major public health issue. Worldwide, there are over 84.2 million people who have been infected with HIV since the pandemic started so many years ago. And by 2021, there were over 38 million people living with HIV. Please keep moving the slides. The sad news is that over 650,000 people have died of HIV and AIDS. At this point, let us remain silent and remember people who we know who have died from HIV and AIDS. May their souls rest in eternal peace. At the moment, we know that there is no cure for HIV and AIDS. To date, there's only 2 people who have been structurally cured of HIV and AIDS. So which means that if you acquire HIV and AIDS, the likelihood of you not getting cured is real. So we'll just go on to the next slides and skip to human papillomavirus. Human papillomavirus is a virus that causes cervical cancer. Cervical cancer kills. And human papillomavirus also causes cancer of the penis. And when you get cancer of the penis, the doctors here know that the treatment is chopping off that organ. But cervical cancer and cancer of the penis can be prevented by giving the human papillomavirus vaccine. There are other STIs like hepatitis B. And the reason I'm sharing them with you is so that you appreciate that HIV is not the only STI. Is that clear? That there are so many diseases that you can prevent by getting immunized, but also by using protection. I'll quickly go through the different rashes. I know you're having breakfast, and some of these images may be disturbing. That when people suffer, please, next slide, please. Keep moving. Next. Yes. These are images which I borrowed from my colleague, Dr. Israel Kalyesubula, showing people living with HIV and AIDS. And this is extensive disease of HIV and AIDS. The next slide shows a disease called psoriasis. And the next slide shows a patient with flat plano warts called verruca planus. And these are just symptoms or pathognomonic features of HIV and AIDS. Kaposi's sarcoma is a cancer that is related with HIV. And the next slide shows genital warts, which are also caused by human papillomavirus. I thought I should show you images of other STIs, including syphilis, that the primary disease is called a syphilitic chancre, or the patient can present with condylomata lata. Patients who develop herpes simplex can also get extensive warts, and they can be extremely painful. The treatment for syphilis is known, and the treatment is giving broad-spectrum antibiotics. Next slide, please. Next, please. Next slide, please. So, even as we pursue life, we need to promote safety. I like a campaign that is ongoing right now, and it's called Yambala for Me. Who has heard about Yambala for Me? Yambala for Me? How come you've not heard? Yambala for Me is a four-pronged campaign that says, Yambala for me, a condom. Yambala for me, a mask. Yambala for me, a helmet. And Yambala for me, what else? What? A seatbelt. Please go back to the slide of that border guy. Do you think that this guy is being smart? How many of us came to this room on a border? Raise your hand. How many of us wore a helmet? How different are you from this individual? Dear friends, let us be serious about prevention of common things that kill young people. It is not only HIV that is killing young people. It is not only STIs that are killing young people, but road traffic accidents are killing young people. Road traffic accidents because we don't wear a helmet, because we don't wear a seat belt, and because we go and start smoking away things that are dangerous to our lives. So, in Makerere and Mulago, we have a general adolescent clinic. And that clinic runs every Friday. It's a free clinic. And we use anticipatory guidance to educate young people like you for prevention. That before you acquire HIV, before you acquire a sexually transmitted infection, you should know the truth, because knowledge is power. Ladies and gentlemen, I hope that during the course of today, you will be educated on how to use a condom correctly. Next slide, please. We must bring hope and let people understand. Next slide, please. Next slide, please. We must produce the power of hope for people to understand that circumcision is one of the key things that has to be done to prevent HIV. That condom use is an important way to prevent not only STIs, not only HIV, but also pregnancy. That giving pre-exposure prophylaxis for high-risk individuals is important, and that we must move outside the day-to-day business to ensure that we get it right. Last of all, I'd like to say, each of us in this room has the capacity to survive. And I will leave you with my own ABCDs, which are: 1, last slide please, ask for what you want, be who you say you are, care about others, and dare to live your dream. Thank you very much for listening.
Doctor, maybe before, I'm going to indulge you just to stay a little longer there. In case we have any questions, first of all, can we give a bigger hand clap to Doctor? Very, 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 very insightful. Some of the pictures traumatizing, but it is what it is. I guess we have to see. Do we have any questions? Anyone with a question, a comment? Just put your hand up, tell us where you're from, and we can take a few questions for Dr. Sabrina. Any questions? Yes, sir.
Yes, thank you so much. I'm Arinda Osubat from Uganda National Students Association. I don't have any question, but I appreciate your good message, and especially Yambala for me, because Yambala for me, it's all about health and otherwise to defend each and everybody. Yambala for me, it's not just on an individual basis, but when you are here, maybe your parents or somebody can be moving. And the moment your person gets an issue, you must be affected. Maybe somebody may not be in a position to pay for your school fees, or your colleague may fall sick because of something very minor. But if there is a protective gear, you can move ahead. Asante sana for your good presentation.
Give him a big round of applause.
Yambala for me, thank you very much.
Yambala for me, a condom. Yambala for me, a seat belt. Yambala for me, a mask. And finally, Yambala for me, a helmet.
All right, tell us your name and your question. Keep it short and simple.
Thank you so much. I'm called Muhanguzi Fred from Metropolitan International University. And my question is, you've talked about the human papilloma virus infection that affects both the male and females. But what I want to know is, how can you prevent that infection from affecting you? Because it's like, even if you protect, still they say that it affects you. So to prevent it, what should you do?
Okay, that's a very quick and specific question. The best way to prevent HPV is by vaccinating. Currently, Uganda vaccinates girls aged 10 to 13 years, but in the private sector, both boys and girls above the age of 13 can be vaccinated. So do the right thing and get vaccinated. The other thing you don't want to do is go around kissing multiple sexual partners, because you will get infected. HPV is highly infectious and it can be spread through kissing.
All right. Beware where you put your lips. Let me just move on to a lady before I come to the gentleman over here. Just tell us your name and your question.
Thank you so much for the chance granted. You were showing us some of the pictures of how they were being affected, the organs they were being affected. So, Madam, I'm asking, is it that those people delayed to reach the hospital to reach at that point, or it is because there is no time to treat those treatment as early as possible? Thank you.
Okay, were you showing us extreme pictures to scare us, doctor? Or let's take another one from a lady.
Thank you very much, the moderator. My name is Namale Esther Florence, the Guild President of Kampala University. My question is, previously, the Parliament has been fighting on a bill where they want young girls who are still in schools to be given family planning methods. To me, my question is, as the people who are trying to come out and fight against HIV, how are we going to help out? Because to me, if government passes that, and these young girls are being given these family planning methods at the young age, it means they have given them a go-ahead to have sex. And at times, people use these condoms just because they fear to get pregnant, not because they don't want to get HIV to a greater extent. Yes, some use these condoms for prevention, for them to get HIV, but others use them just because they fear to get pregnant. So, where do we see this generation, the young people whom the Parliament is debating to be given family planning methods, want the HIV in future or 10 years from now be at a higher level, yet we are saying that by 2030 we should have ended it. So I don't know how we can help, and I really want to hear that.
I'll allow you to just respond to those, then I'll get you two more.
Oh, thank you very much for the questions. Please give them a big round of applause for those questions. Now, the thing is, the images that I showed you were aimed at doing two things. First of all, for you to appreciate that this can happen. Second of all, that a lot of times young people fear to come, and they come when it's a little bit late. The third point I'd like you to take on is sometimes those images don't even show. They show much later. 10 years into your marriage, when you cannot have a baby. That the infection stayed in your fallopian tubes and destroyed them, and you cannot have a baby. The images I showed you are characteristic images of sexually transmitted infections. That's how the patients present. Sadly, some of them are silent. Now, the debate on whether girls should be given contraception is still a debate. The truth is, 1 out of every 4 girls in this country has become pregnant before the age of 18. People don't drink pregnancies. They don't drink them like water. They have sex and they have pregnancies. So unless we wake up and smell the coffee and understand that we need to talk about prevention, prevention of pregnancy and prevention of early teenage pregnancies, we are not going to go far. Condoms are just one of the ways in which pregnancy can be prevented. But for young people, they need dual prevention. Studies have shown that in universities especially, the first day the couple will use a condom correctly, the second day they will try to use the condom, and the third day they will throw away the condom. Is that true or false? I hear true. So unless we in this room become change agents, unless we say no to HIV spread, unless we say no to HIV acquisition, then we are all wasting our time. Thank you.
All right, thank you, Doctor. We'll just take the last two questions. I'll take a gentleman and a lady, all right? Please.
Thank you for the opportunity. I'm Bonga Nathan from IUIU, and probably you spoke about the issue of giving more emphasis on girl child and forgetting about boy child. Really, it has been a challenge, and I'm so surprised that our mama spoke about it. Richie, please, let's give her a hand clap. This issue of girl child education, really, it has been more emphasized more than boy child education. Why? It has resulted in two issues of boys involving themselves into drugs, theft, bad activities in the society. Really, if I can give an example of my home area, that's Mbalo, of course. I'm a Mugisu, and I'm proud of being a Mugisu. Thank you. That issue of boy child education, boys they've been forgotten about being taken care of. So really, please, let the government try to put more emphasis on it. And probably we thank you so much for enlightening on it. Thank you.
Can the boys please stand up at this point? Boys, stand up. Boys
Boys
stand
and
up.
men. Boys
Boy
and
child.
men.
And let's say boy child oye. Boy child oye. Can you make us, boys who are here, can you please stand up? Unless you're girls. Yes, men and boys.
Doctor was saying I'm a man.
Men and boys, let us make a special promise to each other to be different. Can we say, I am going to be different?
I am going to be different.
I am going to be a boy champion.
I'm going to be a boy champion.
Say it louder. I am going to be a boy champion.
I am going to be a boy champion.
Thank you very much.
A boy child, oh yeah?
Oh yeah?
All right, I'm going to take just one more question from a lady. But in the meantime, captains of the different universities, we're getting into the quiz right after this. If the captains could just move out and meet Paul, is at the back there waving. We need to get your contestants. The rest of us, on your papers, on your tables, there are papers with the program. Any question that you have, it might be related to what Doctor has talked about or anything related to our general topic today. Please write down those questions. We're going to be collecting them. I see many hands, but I'm sorry, in the interest of time, I'd just like to take one more question from a lady, and I see one back here.
Thank you so much. My name is Kopsinjo Winnie, Guild President, Multitech Business. My question is, how are we going to create awareness about the sexually transmitted diseases, especially the warts? Because there are very many girls there that are suffering or that are having warts, but they are not even sure of what they are suffering from. Then another question, what roadmap is the Ministry of Health going to follow to access those people in deep down in upcountry centers, I mean those in Katakwi, and what is the ministry going to do about that? Because I believe not everyone is here from those centers. It is only the universities or the institutions from the central region that are here. Thank you so much.
Give her a big clap. I think that engagement starts with those who are affluent. And it is us who are affluent that then go ahead and influence other people. Each of us is going back home for Christmas holidays. Be ambassadors. Educate the people where you're coming from so that they are part and parcel of this change. The other thing I want you to know is that the Ministry of Health has an entire program for adolescent health with an assistant commissioner. And this assistant commissioner is responsible for the entire adolescent health program. So they are going to reach every single adolescent in this country. Rest assured. Thank you.
All right, I think we can do better than that. DJ, can you give Dr. Sabrina a song as she goes down? Let's clap for her. We can do better than that. We can do better than that. In the meantime, I'm going to ask our team to get ready to give us an entertainment interlude. I'll be inviting you right in the next 2 minutes. I hope you're ready, all right? But like I said, just to emphasize, if you have any question, we're interested, like Dr. Busengu said earlier, in receiving as much feedback from you as possible. So we'd like you to write those questions down. Even after lunch, we have panel discussions. Some of those questions are going to be addressed in the same panel. So please ensure to write those questions down. We're going to be collecting them shortly. After our entertainment interlude, we're going to get ready to get into our inter-university challenge. Now, Dr. Sabrina, the people in charge of the challenge are not too happy with you. They said all the questions they have prepared, you have given all the answers. Now, I don't know how they are going to. So, it's going to be up to you. You can't say you didn't know. If you are paying attention, then you should be able to do well in that challenge. So, university captains, get your contestants ready. After this short music interlude, we'll be getting ready to get into the quiz, okay? I'll ask the DJ just to give us a short music interlude as the Baylor team gets ready to come with their piece. Mr. DJ. Okay, who was the DJ's balance?